Hi everyone, welcome back to our nursing exam prep series. Today we're going to be looking into some multiple choice questions related to fluid administration. So let's dive right in. So question number 1, what is the most important assessment before initiating IV fluid therapy? So we have 4 options. I'm just going to go through all of them. So A, patient's weight, B, heart rate, C, patient's fluid and electrolyte status, and D, blood pressure only. So the answer is C, patient's fluid and electrolyte status. Question number 2, what type of IV fluid is isotonic? A, 0.5% of sodium chloride, B, 0.9% of sodium chloride, C, 5% dextrose in water, or D, 3% of sodium chloride. And the answer is B, 0.9% of sodium chloride or normal saline. Question number 3, a patient with hyponatremia requires which IV fluid replacement? A, 0.9% sodium chloride or normal saline, B, 0.5% sodium chloride, C, dextrose 5% in water, or D, 3% of sodium chloride. And the answer is D, 3% sodium chloride. Question number 4, which route is most important for fluid administration in an emergency? Is it A, oral, B, subcutaneous, C, intravenous or IV, or D, intramuscular? And the answer is C, intravenous. Question number 5, which of the following signs indicates fluid overload? Is it A, hypotension, B, edema and crackles in lungs, C, dry mucous membranes, or D, weak pulse? And the answer is B, edema and crackles in lungs. Moving on to question number 6, what is the primary reason for administering potassium chloride via IV? A, correct hypokalemia, B, prevent dehydration, C, to increase urine output, or D, to treat hypernatremia? And the answer is A, to correct hypokalemia. So, moving on to question number 7, the recommended maximum rate for IV potassium infusion in adults without cardiac monitoring is it A, 10 milliequivalent per hour, B, 20 milliequivalent per hour, C, 40 milliequivalent per hour, or D, 60 milliequivalent per hour? And the answer is A, 10 milliequivalent per hour. Question number 8, which IV fluid is considered hypotonic? Is it A, 0.9% of sodium chloride, B, 0.45% of sodium chloride, C, lactated ringers, or D, dextrose 10% in water? And the answer is B, 0.5% of sodium chloride. Moving on to question number 9, a nurse is monitoring a patient receiving IV fluids. Which parameter best indicates effective fluid resuscitation? Is it A, decrease in urine output, B, presence of edema, C, increase in respiratory rate, or D, stable blood pressure and heart rate? And the answer is D, stable blood pressure and heart rate. Question number 10, what is the first action if infiltration is observed at an IV site? Is it A, slow the IV rate, B, elevate the limb and apply heat or cold as needed, C, stop the IV and remove the catheter, or D, continue IV as prescribed? And the answer is C, to stop the IV and remove the catheter. Question number 11, which type of IV solution is appropriate for a patient who is dehydrated with normal serum electrolytes? Is it A, D5W, B, 0.45% of sodium chloride, C, 0.9% of sodium chloride, or D, 3% of sodium chloride? And the answer is C, 0.9% of sodium chloride. Question number 12, which assessment should the nurse perform hourly on a patient receiving IV fluids? Is it A, lung sounds, vital signs and IV site, B, blood glucose only, C, bowel sounds only, or D, temperature only? And the answer is A, lung sounds, vital signs, and IV site. Question number 13. Hypertonic solutions are primarily used to, is it A, rehydrate the cells, B, expand extracellular fluid volume, C, maintain urine output, or D, treat hyperkalemia? And the answer is B, to expand extracellular fluid volume. Question number 14. The nurse should avoid rapid infusion of hypotonic fluids under which condition? Is it A, hypernatremia, B, cerebral edema or increased ICP, C, dehydration, or D, hypotension? And the answer is B, cerebral edema or increased ICP. Question number 15. The safest method for administering IV potassium to a patient with cardiac arrhythmia risk is it A, rapid IV push, B, IV piggyback slowly with monitoring, C, oral tablet only, or D, intramuscular injection? And the answer is B, IV piggyback slowly with monitoring. Question number 16, and our final question for today. A patient receiving rapid isotonic IV fluids develops crackles in the lungs, a bounding pulse, and JVD. What is a nurse's priority action? Is it A, stop or slow the infusion, B, lower the head of bed, C, replace the fluid to hypertonic, or D, send patient for chest x-ray? And the answer is A, to stop or slow the infusion. To summarize the overall questions for today and a couple of the objectives, which included proper fluid administration is essential for patient safety and recovery, frequent monitoring and correct fluid selection prevent complications, nurses must be vigilant for signs of overload, infiltration, and electrolyte imbalances, IV fluid administration is essential for hydration, electrolyte balance, and medication delivery. The key types are isotonic, hypotonic, and hypertonic solutions. And finally, monitoring is crucial for patient safety. Thank you for listening, and I hope you tune in for our next set of questions.